Okay, most of you, except for our visitor, know what we do. We're a employee benefits firm. What we're concentrating on is health benefits, but we also do all the ancillary benefits as well. If you've got a little breakdown here. Who are we? We're three brokers. John and I have 17 years experience. In fact, today is our anniversary of 17 years with a license in Florida. Dan is way behind us. He only has 16 years. John and I concentrate on the group side. Dan concentrates on the individual side. We go, wait a minute, this is a business-to-business organization. But when you're doing a health enrollment, some people are going to need individual, especially for their family members. Because family members are very expensive on small plans. What's a small plan? Under 25 is definitely a small plan, but even under 100, you're not going to get quite the deals you can. We also specialize in something called self-insurance, partial self-insurance. Why? It saves you money. But let's stick to the agenda. Will the Affordable Care Act go away and when? No, it's not going to go away. When is it going to be fixed? I mean, at first, the Democrats couldn't do anything because they had no control. Now they have control of one house. It ain't going to be enough. In there, if you go forward a page from there, you'll see an article. And it says, Trump IRS seeks millions in Obamacare fines even though the law is dead. That was last year. In other words, the IRS is saying, we don't care that you pulled out the individual mandate. The group requirements are still there. And we want you to pay. If you have more than 50 employees full-time and you don't have insurance for them, it's $3,000 per employee per year. That's a chunk. I'm also going to pass something around if you're interested, all the different fines that they're subject to and regulations. Why do I do that? It's one for everybody. Basically, to comply with the law, you need an HR department. And most of the firms I deal with say they have an HR department. In fact, I do a lot with medical practices, and they have what's called a practice administrator. You would think they'd know something about health care, not health insurance. So that's one aspect. Why do we worry about our health care? Why do we want the best plan possible for our employees? I guess we wait till we get the floor back. What are you doing?
I don't know.
It's one report.
He was confused.
What?
He was confused.
Oh, okay. Anyway, one of the major reasons you want decent health care is to retain employees. Employees, that's in most surveys, what they say, the number one thing they're looking for besides salary is health care. It's just too expensive otherwise. So you have to think about what happens if you lose an employee about it. And there's a couple articles in there that go over that. Most of the surveys come out between 6 months and 9 months salary of that employee is the cost of replacing him. That's a lot of money. If you got a $40,000 a year person, and that's not a very highly paid person, that's $30,000. And it's important to give them a set of benefits that they're happy with. We go into all kinds of different, we have telemedicine, we have wellness programs, a lot of things that come in to allow us to maximize the use of that money. And what kind of money are we talking? We're talking about the second most expensive thing a firm does, next to salaries. We're it. I'm not walking into some place like Allen and saying, I want $1,000 or $5,000. I'm walking in and telling you your premiums are going to be, for a group of 10, it's going to be $5,000 minimum a month. If you had a regular plan. On self-funding, you can cut that down. Now, you're taking some risk with that, but those risks are covered by something called a stop loss, which is an insurance policy. Most firms are self-insured. I'll guarantee you guys are self-insured, and if you're not, you should be. But which is good, because that allows you to, oh yeah, and that's important. Self-funding plans have lower rates, and they return any excess goes back to the firm, not to the insurance company. That's important. That's how you use it to reduce cost. Let's go ahead and go a little further in here, though. Alrighty. I mean, there's a couple things on benefits of self-funding, the wellness programs. Programs are critical. Without a wellness programs, you're not doing anything to improve your health care. If health care goes down in a firm, I don't care what they say about it being community rated or firm rated, it doesn't matter. You use it more, your rates go up. And right now, with the government not giving you much cover, it's going to stay that way. I was hoping that with the Democrats having some being back in, they'd just repair the Obamacare. Nope. Now we have people talking about Medicare for all. We have people talking about reparations. We have people talking about, it's crazy. And basically the insurance companies are risk adverse. What does that mean? When they see confusion, when they see the government not able to act, they have one response: raise prices. So it's important to have brokers that understand this. There's also other things no one even thinks about, like COBRA. Everybody in a firm of 50 or more is required to have COBRA, a national COBRA. What does that mean? It's your continuous coverages after you've left the firm. It's for 18 months. You have to tell COBRA about it. You have to, you have to send out information to your employees. You have 30 days. On the 31st day, if you haven't done that, your employee can walk over to Morgan & Morgan and file a suit. And it can get expensive. So there's all kinds of things playing on the business now. We're there to make it as easy as possible. We're tailors. We're not off the rack. A lot of firms that you've been with, well, your insurance was with United, so your dental was with United, and so was your vision. United doesn't know anything about dental and vision. They're a medical firm. They hire other firms to do that for them. We don't do that. We tend to use VSP as our vision provider. We tend to use Renaissance, or which is Delta of Michigan, or we use Delta itself for our dental plans. And we get better benefits that way. That's how that works. Again, the goal is to reduce cost and improve health in the firm. Getting firms to engage, well, it's kind of like herding cats. You just got to keep at it. One thing that has been a surprise to us and is now working very well is what's called telemedicine. Telemedicine allows you to, it's 2 o'clock in the morning, Saturday night. You got a sick kid. You don't know what to do. What are you going to do? You're going to go down to the ER? Worst possible care you can get, unless the kid's really sick. You call up telemedicine. A doctor will call you back, registered doctor, state. If it's a child, it'll be a pediatrician. If it's for you, it'll be an internist. And they'll talk to you over the phone, and they can prescribe for flu. They can prescribe for minor infections. A lot of things. You'll be in the middle of that call, and they'll go, "Okay, I want you to take your phone. I want you to take a selfie. Open your mouth, say ah." And they do things, crazy things like that. They can also Skype in that. Then they give you a prescription. It's sent into your provider. The next morning, you've got it. You don't have to miss work. Teachers love it. A teacher in this state not only has to have a substitute if they're not going to be there, they have to get that substitute. They are responsible for making sure the substitute is there. Worse than that, it's for the whole day. So it's to the advantage of if they can do something at 2 o'clock in the morning, it's better. And we found the sweet spot on that. If you charge $20 the same as, or $30 the same as an appointment, nobody uses it. If you charge $20, nobody uses it. If you charge $10, a few people use it. If it's free, everybody uses it. And that's how we set ours up, so that it's basically free. We have a list of our vendor partners. Apparently Colonial is leaving me because they're faded out there, but Colonial's in there too. We deal with everybody. You know, we prefer, there's certain firms we prefer, but we're registered and we're agents for everybody. Any questions so far?
So Michael, when is Medicare going to start doing telemedicine?
Medicare doing telemedicine, that's a good question, Steve. Medicare hasn't said. I've been looking for that. They are, now I will tell you this, United now has telemedicine with every one of their plans. It just comes. And they're actually Teladoc, which was the original one. There's others too. We use MD Live. We do a lot. There's 3 big ones out there. The one other thing we do is that when there's an enrollment, we're on site. A lot of firms, they just say, you know, Brown & Brown will send in a group of enrollers and that's it. Enroller is great. He's there. What is the enroller there to do? Enroll you in the stuff that is part of the health plan and sell you as much ancillary, you know, voluntary product as they can, because that's how they get paid. If you don't have a broker on site, they can run wild. We have a broker on site for every one of our enrollments. We also control for the firm when those brokers can come in and when those agents can come in. That's why we use Colonial. Aflac, by the way, their product's fine, but they're locust. They'll come in every month and try and sell stuff. And that, by the way, is illegal under the way we have our health plan set up. Anything that's in your wrap, which is what you're offering as your benefits, is you can come on at open enrollment, or come on new hire, or come on a change in status. That's it. So you can't go in 2 months later and go, you know, I want that vision plan, or I want that dental plan. It doesn't work that way. Anyway, it's a matter of education. You educate your employees. Any questions?
Now, one of the things that I do, I don't know if this is a good subject for you, but one of the things that I do is when I talk to people at the end of my job of talking to them about my company, I tell them I'm a member of this group and what we are, and then I'll mention, depending on the kind of group that I'm talking to, but I might mention to them, hey, you got 50 employees. I know a guy that does health insurance, and he'll come and give you a free evaluation of what you have right now. Mm-hmm. And my next question is, isn't a second opinion always a good thing to get? And most people agree.
And your question is?
So, is that what we're working on?
Yeah, but I wouldn't say I know a guy who sells insurance. I know an excellent brokerage that does this and specializes in firms your size, whatever size they are, and can come in and talk to you with no obligation.
And you get a second opinion.
Yeah.
So what would be the right things for us to listen for to find that opportunity for you?
There's a whole page of it, but basically we're looking, the types of firms we work with right now are municipalities, medical practices, ambulatory surgical centers. Oh wait, that's what we're looking for. Sorry, no, yeah, that's what we have. Trucking companies, Broadway theater companies, contractors, and local hotels. Types of employees that we would like to work with: medium to large law firms, healthcare nursing firms, call centers, industrial companies, high-tech and IT firms, dental offices large, pharmacies, and by the way, we now have 13 pharmacies that we provide health care for.
Is it one brand, or is it?
What?
Is it one company?
No.
No, 13 different.
13 different, yeah. Well, that's not true. There's 7. One's got
okay.
6.
It makes sense. That's
Yeah. And they're expanding. By the way, pharmacies are expanding. They're making a fortune.
Of course.
Because the rebates go back to them.
When you say you are looking for medical practices, a typical medical practice, if it's a single practitioner, maybe has 6 or 7 employees.
Yeah.
Is that something you...
I would do it, but I prefer our minimum is 10, really. Well, our sweet spot is 25 to 300. We've done firms of 1,000 before also. It's, it all depends. Medical, you're a little behind the times, though, with medical practice. There are no more single practitioners out there
I have several
because the costs are ridiculous.
Several of my doctors are single practitioners.
Okay, yeah, I'm not arguing with you, and they're all bought by the hospitals now, and that's a real issue too.
Is that hard for you to get into because the hospitals offer better programs?
Yeah, the problem with the hospital is I have an excellent inn at Florida Hospital, and my wife has ethics. She won't do a thing for me there.
Let's hear it from Michael, thank you.
You're welcome.
Now you can take off the microphone.